Hey, you guys, welcome back. Another week. This month we have been covering weekly SOAP notes on the topics that we have been going over for the week. So this week we covered the pediatric integumentary rashes. I like to use one of the scenarios from practice questions that we completed on Wednesday with our Work It Out Wednesday, and use that scenario and apply it to a SOAP note so you can see it in this fashion as well. I like to prepare you for boards as well as practice, right? So I want you to be able to take scenarios, apply it to your documentation, apply it to boards, but see the connection. So also while you are studying, also while you are preparing to be an NP, also while you are going through school and clinical, you'll understand how to take the foundational knowledge and apply it, okay? So, all right, as always, I like to kind of run through what each thing stands for, give you the scenario again that we'll be using, and then we'll work through it. So, the scenario will go off of this question. Miss Kelson presents with her 3-year-old son stating that he has been crying due to a sore mouth. As the nurse practitioner completes an assessment, it is noted that there are sores to the mouth and some to the patient's feet. What is the best diagnosis? But that was a question, whatever. Patient was diagnosed with hand, foot, mouth, right? And we'll get into that. But foundational knowledge. SOAP is an acronym for our documentation, right? It allows you to break it down so you can quickly identify it in certain areas for your subjective, objective assessment and plan, right? It gives you an easy way to document, but also when someone else is to pick up where you left off, whether it is for a consult or if it's somebody who is seeing a patient after you, maybe you're not there or they had to step in, whatever, they should be able to pick up this note and know exactly what's going on as if they were in the room there with you, right? And quickly identify and see what was done, or even you for follow up to see what happened, what they stated, what you saw, how you treated, so you will know how to move next, right? So again, SOAP is subjective. Um, SOAP is SOAP. The S is subjective. The O is objective. The A is assessment, and the P is plan. So for subjective, let's get into that. Subjective, we are looking at what the person is stating. What is wrong? What's the chief complaint? You put your HPI, all that goes in this area, right? So in this scenario, subjective, the chief complaint is that this 3-year-old child, the mom states, has been crying due to a sore mouth. So this chief complaint is the child has a sore mouth, right? I like to put the age in. They're 3 years old. They're crying. The patient is afebrile. Okay. And so typically here, I also like to give a quick little blurb and I tie it all together. So I would have said, uh, mother presents, or like in the scenario, Miss Kelson presents with her 3-year-old son today, stating that he has been crying, complaining of a sore mouth. She states it's been going on for such and such, whatever, and tie all of that together. Patient is afebrile. She denies any fever since she noticed the sores, etc. Just tie the story together. Objective is what you observe. So what do you see when you are doing your assessment on this patient? So it stated in the scenario of the question that upon exam, the nurse practitioner noted sores inside the mouth as well as on the soles of the feet, right? So here, just quickly noting that, and also I like to tell you, objectives, we put our vital signs here as well, right? So as you're observing, you did your assessment, sores to the buccal mucosa, sores to the palms of the feet. Um, Patient is tearful on assessment. Patient is afebrile. Put all of that here. Assessment. I always tell you assessment is where you tie everything together, right? So I know we kind of think of it like, what are you currently assessing? But you have done the assessment when you are listening to what they are stating is going on and understanding that chief complaint and asking specific questions so that you're getting the statements that you need from the subjective portion. That's a part of your assessment. The objective, what you're observing, the vital signs that you're doing, assessing the buccal mucosa, looking at the sores, those things. This is formulating your assessment. You are assessing them during that time, right? So in the assessment section, you're just providing an overall summary of what you have assessed and what you are thinking is wrong at this point, right? So here we know this is classic hand, foot, mouth disease. So that's our diagnosis. We'll say Sores noted to the buccal mucosa and soles of the feet. The patient is tearful. Patient is afebrile. Okay, so that's here for our assessment. Also, typically, you'll kind of add in your extra but plan, because typically assessment and plan are together. You'll hear it like A and P, right? Because you want to see that everything tied together and what's your plan on how to treat. So, I always say plan, what's your plan stand, right? Like, how are you going to treat them? What's the next steps based off of all of this that you have tied together? So you have allowed the person to tell you what's going on. You have looked and assessed to see your further, to tie together their story and what you see. You put it all together in a nice little summary and bow for the assessment. And now you're going to take all of that and provide your plan, right? So here, first, when you think of hand, foot, mouth disease, you need to think of how you treat. And truthfully, it's symptomatic management. So if they're in pain, we're doing our analgesics, antipyretics if they are febrile. But starting with the top, the mother has stated that the 3-year-old has been crying, tearful, with the sores in the mouth. So we definitely want to provide an analgesic. So it's telling the mother, instructing her and advising her to provide the patient with Tylenol. He's 3 years old. With their kiddos, that we need to look at their weight and age. So telling her the instructions, like typically, it ranges from, with that age group, about 2 to 3 years old, from the weight class of 24 to 35 pounds, giving them 5 milliliters every 4 hours, right? For 24 hours, but you want to make sure you're telling her that she can do that. So you can give the child 5 milliliters if he fits into that weight class. We know he does fit that age, providing the 5 milliliters every 4 hours as needed for pain, but making sure she knows not to exceed that 4 times a day. So don't give it a fifth time, right? Instructing her on how that can cause, liver damage and toxicity. So you don't want to give it more than those 4 times within a 24-hour span. Um, so that's the analgesic purposes. With kids, we can do our Tylenol, ibuprofen, but for these purposes, we'll start off with the Tylenol. Also, instructed them that with children with the sores in the mouth, it can affect their hydration, because of course, if their mouth is sore, they're not going to want to eat or drink as they normally do. So making sure to tell her to, one, monitor for any fever, since we were already given the Tylenol. So maintaining and monitor that temperature to make sure they're maintaining that afebrile state, because the Tylenol can also assist with that. But also for hydration, to monitor to, their intake. Are they having any changes? If they're doing fine, then fine, that's perfect. But if not, you want to make sure that you are pushing those fluids, the water, Pedialytes, because you need to make sure the electrolytes are where they need to be. And softer foods are better during this time, because think about it, their mouth is sore, and a lot of times they can have like ulcers on the back of their throat. So swallowing can be very painful. So although you may not see them, they can typically be there. So you want to make sure to kind of help them with this process. So softer foods, like puddings or mashed potatoes, and popsicles, smoothies, things of that nature are really good choices at this time. And then again, I talked about them being afebrile, but all this is going to the plan. And then just letting the mother know that typically this does resolve in a week, like in between like 5 to 7 days. So just monitoring it, making sure that the child is not, if not having a fever, spiking a high fever, just continue to gauge it. That the child is not becoming dehydrated or just completely not eating, just monitoring those things and making sure it's not worsening. And that is about it. And so then we move on. So when you have the SOAP note, it all flows together as one assessment. So you can kind of see it after you have done all those sections, so that you can see everything that's going on. But also, if you are just looking and you're like, all right, let's see what we did last, you can go straight to the plan and see what you did and treated. So it's a good little breakdown for that. But as always, you guys, thank you for watching. I hope that you found this helpful. Please be sure to like, comment, and subscribe, and share with whomever you may think finds this helpful, who can find this helpful as well. But meet me back here next week. Bye, y'all.